what is different about the Medicaid Care Coordination Program, the MCCP? Why is this different than what other people may be trying throughout the country? Why it's different? We've already shown over a 12-month period how we have improved the care coordination as a provider-directed model in 4 states, in 6 senior care communities throughout this country. We've already done it. So it's like, why not? So, another question that's an interesting one to ask is, well, aren't other nursing homes and hospitals and managed care companies doing this already? Actually, the answer is no. Pockets are doing programs like this. Pockets are having hospital staff coming in Pittsburgh, Ohio. Great pilot programs occurring, but nobody takes these separate silo systems and says, get together once a week, coordinate the care in one room on a sample population in a 30-minute or more period of time and get it done. Nobody's doing it. Nobody. This is a very simple. A lot of people are bragging about metrics. The hospital system's doing a great job in metrics. The managed care companies in Ohio, in Pittsburgh, are doing a great job looking at metrics. But is anybody sitting down looking at those human beings and say, hey, together as a team, we are owning the model, we being the nursing home providers in this country, we are taking charge of these patients. It's up to us. We're caring for these human beings 24/7 anyway. So let's get it done, not worry about politics and hospital systems and this system and managed care companies. Why don't we put ahead of us the patient? God forbid, the patient that's in our charge, and say, let's step back and do something about it. So how does the MCCP program work? There were a number of key points. Number one, it's a centralized provider-directed model run solely by nursing homes with our partners from the hospitals and the managed care company. That's number one. Number two, we collaborate with the multiple care and service providers, one time per week in the room. Very simple. Number three, we develop and measure 5 quality and cost metrics, namely rehospitalizations, falls, pressure sores, emergency room visits, and drug costs. All drugs that the patient is on, not just one drug of a psychotic and antipsychotic antibiotics. A lot of people looking at those 1 or 2 little drugs. I'm saying, to heck with those 1 or 2 little drugs. Let's look at everything that Tilly or Sam is on, and why, and how much are we spending on that. So we develop and measure the 5 quality and cost metrics. Number 4, we implement weekly patient review protocols with these provider groups together at the same time. And 5, we conduct monthly participant evaluations. So the 6 senior care communities in the 4 states got together by phone once a month for 20 to 30 minutes and said, hey, how is the pilot, how is this program going? Are we accomplishing? Let's say we're moving up in rehospitalizations, maybe we steer it back down. So by getting the pilot participants together on a monthly basis, we looked at how do we improve based on metrics and quality and care. So in summary, why not implement a very simple project that reduces rehospitalizations by 5 to 10%, drug costs by 5 to 10%. We're spending, as it is, $15 billion on drug costs and rehospitalizations costs throughout the country. So something that saves $750 million has amazing potential. So what I'm asking the public to do is to ask your senators and ask your congressional representatives to be in favor of recommending to the Congress and House that this becomes law. Why doesn't this country say, hey, Medicare and Medicaid should implement the MCCP in all states in the United States for the 15,600 nursing homes now to replicate what we did in these 4 states, the MCCP pilot. We're also attempting to arrange with local national foundations to fund a larger scale pilot to come up with a more formal model. But you know what? People in the nursing homes and hospitals and managed care companies can replicate this right now with or without the law changed, just using their brain and their guts and leadership. Just like the LA Jewish Home, the New York Jewish Home said to me, Richard, we know you're stopping the pilot temporarily in the homes right now, but we're going to keep it going anyway because we think it has amazing, simple-to-use implications, what we've seen at Menorah Park, at the LA Jewish Home, at the New Senior Life Jewish Home in Manhattan, New York. Why not do it now? So the call to action is ask your senators, your House leaders to get it done now, the Medicaid Care Coordination Program, to just do it and move ahead with improving the care of the nation's seniors, the vulnerable, low-income folks on Medicaid throughout this country, and save the nation money, at least $750 million right now. Thank you so much.